Hello, leaders of the word. Welcome to Spread Love in Organizations, a podcast for purpose driven healthcare leaders striving to make life better around the world by leading their teams with genuine care, servant leadership, and love. I'm Naji, your host, joined today by Karine Duquesne, Vice President, General Manager of LEO Pharma France. Karine previously held the position of General Manager at Actelion Pharmaceuticals France and Johnson & Johnson's rare disease subsidiary prior to its merger with Janssen in 2020. She holds a doctorate of pharmacy degree and has more than 20 years of experience in the pharmaceutical industry within various positions from medical affairs to head of marketing and sales. Karine is French and has enriched her career with international experiences in the USA, with Janssen's global and strategic teams in immunology and neuroscience. Karine is passionate about people development, innovation, diversity, and inclusion. Karine, it's a pleasure to see you again and have you with me today.
Thank you, Naji, and thank you for hosting me today for this podcast on leadership.
I would love first to learn more about your personal story. So what's in between the lines of you becoming a pharmacist and now leading pharmaceutical companies as a general manager?
My career is more linked to opportunity, to really something that I have decided for a long time. Science and caring for people was something very important for me when I was young. But deciding between medicine, being a doctor, or being a pharmacist was more because of some leaders I met during my studies. And when I started as pharmacist, as a student, I decided first to work in a retail pharmacy in France because of the relationship you can have with people, with patients. I was so dedicated to patients that I thought firstly that my part to play was to be close to people. And then I met a fantastic leader, a woman from GSK, and she shared with me her job, her passion for the industry environment, and how you can impact being part of the industry company. So I asked for a change in my student part, and I moved from retail pharmacy to the industry development. And then I joined Janssen as a mentee, not a mentee, as a trainee. And I spent 24 years with Janssen, growing through the company. I think I have held all the positions you can have in medical affairs, in commercial, in training, in compliance, everywhere. And I grew up like that. More, once again, it's not a straight line. It was more opportunity, new project, new people, new leaders that who really inspired me. And then I'm here today.
I love it. Thanks for sharing this, Karine. You've led throughout your career, as you said, different teams, different functions, med affair, commercial, and now general manager. You've also led in different countries, different companies. Now Johnson was your longest company you stayed, but you moved since. Do you see a common thread or kind of a leadership theme leading people across all those experiences you had?
I think the common thing is more linked to myself first, is that I am really authentic. When you see me at work, I'm exactly the same person in my personal life. And it's one of my convictions, supporting people to be themselves at work. It's really important. The other thing is about passion. I think this type of job, you need to be passionate by your job to be sure that you can deliver and you can go the extra mile, because in our job, we need to deliver, we need to take care of people, we need to manage so many different topics a day. We need to start the day, be so passionate by our job. And the reason why, and my personal purpose, is to serve the patient across the French environment today, but across the world, and be sure that I can be a small piece in a big part and contribute to that.
So you shared this as you transition from being in retail pharmacy and working with patients directly to now this word, and you go back to your purpose and passion that I think many of us, if not all of us in healthcare, actually really have, this helping patients live better. Can you tell us a little bit, because I have a lot of those discussions with still practitioners, how do you see your impact daily? How are you missing this patient interaction, for example, that you had in the pharmacy, or how do you see it today?
The way I see it today is more across the patient organization. I had the chance that it's really important for me to keep a strong link and relationship with the people leading a patient association in France. It was really important in rare disease for sure, because especially during the COVID period, I remember the time we spent with the head of the patient association we worked with at that time, just to be sure that we can be present even during the COVID period and to serve patient. And we were so passionate to be sure that we can support them more than before, that we can push all the barriers with the support of the French healthcare system. And for example, for people suffering from PH, going to the hospital during the COVID period to receive their injection, it was too dangerous for them. And you can't bring the treatment to their home. In France, during the COVID period, we had exceptional authorization for the healthcare authority to do that for them. So it was tough to imagine we can do that, but in 2 weeks, we made that possible. So that's, for me, the best example about caring for patients and be close to them, even if you work in a pharma company. So you can do that every day. Next week, we will organize a race. And the race, it's about the patients suffering from inflammatory chronic disease. And we will all, the employee of the company, running for them. So there are different ways to support and to be present for patients across their association. And every day when I wake up, I know that I will work for them, whatever. That's my way to think about that every day.
It's certainly why we wake up every morning. I'm interested now to take you a little bit back in time, but one of the questions that I frequently have, since I also, like you, French, moved to the US, I frequently get this question about your experience in the US. So I'd love to get your thoughts on this. What's common, and how did you lead in different cultures? What did you learn from those different experiences?
Yes, it was an amazing experience for me and for my family, because I moved with my kids and my spouse. It was really amazing. The difference in terms of culture is huge, but when you talk about leadership, for me, there's no difference. Remaining who I am, so optimistic, so energized every day, so passionate by my work, how I can impact, how I can support my colleague, be a good partner. I guess I did that in the same way than what I was doing when I was leading an organization in France. And very, very quickly, I was the French woman people would like to have lunch with, just to share something new. And when I was in France before moving to US, I had a lot of opportunity to mentor people. So I have mentee in Europe, in France, in my organization, outside of my organization. And when I moved to US, I realized that it was known, and US colleagues asked me to mentor them or mentor someone in their team. So for me, that means that being authentic, supporting people, be so focused on people development. It's something that you can drive or develop in the same way, whatever the country.
I definitely share your view about how to lead, and the way you lead people is kind of human, right? Like the human way that you're describing. I'm interested, you said you were the French woman when you were in the US, and I know you're passionate about diversity, inclusion, and those topics are sometimes tricky. Like we have different views. You might have enjoyed being recognized as a French woman or not, actually. So I'm really interested in your view about this specific example, but also more broadly, how do you think about diversity, equity, inclusion within your teams?
Yeah. It took me a long time before being so focused on the women traits of leadership, because firstly, being a young leader, it was really important for me to be recognized as a leader before than being recognized as a female leader. But right now, knowing and having a young woman I talked with about their career, I realized how it's still difficult to grow as a female and be authentic. And even right now, with more mature female leader, there is always this question: can we be ourselves as a leader? I am a mom of 2 teenagers. To be honest, my more difficult job is to be a mom. It's more rewarding, but it's so difficult every day. So I think that being able to be vulnerable at work, it's perhaps something that seems to be a female trait, but I'm sure that you are someone that can show your vulnerability, Naji. I know you a little bit, I know you can. So it's not only female traits, but because the gender equity is not there, we need to be supportive and be sure that there are equal chance for young women to be perhaps more supported and to have the same chance that young men to develop themselves and to be themselves, and not trying to change their way of working to make people understand that they can be a good leader.
Can you share with us some examples where you helped young leaders, women leaders throughout your organizations, and how do you do this to ensure that those opportunities, especially that now you have this influence and power, if I can say, as a general manager, how do you ensure this is happening consistently across your organization?
I do that through different ways. The first thing is that being a role model, not to be focused on myself, but just to be sure that I can show young female leader that you can be yourself, you can be a mom, you can say, I can't join this meeting because my son is sick or because it's his birthday, and it's more important for me that this meeting. These small things that in business, most often you keep for yourself and you manage as you can. And just showing that you can develop yourself, you can grow in a company, in an organization, while be so clear that your children will remain your first focus. And same thing, being authentic, sharing some personal difficulties sometimes, not my personal life. I can talk a lot, but just to share that it's difficult for me too. Some days I'm sick, some days I'm not in a good shape, and don't try to hide this difficult moment because it's human beings. So same word, being authentic. In another way, I use different mentoring program, because I think sometimes it's not only about someone being there. You need to structure the approach and help people just to say, I would like to be supported, or what does that mean to have a mentor compared to a coach, or compared to more senior leaders pushing on your back. So just giving some example and having a structured approach, meaning something that will last long time enough to be supportive, because only one discussion or one touch point is not enough to really deep dive and support someone in the right way.
Those are great practical examples. And I love what you shared about having your kids' birthdays or any milestone in their life. I remember a great mentor once told me, you will always remember a missed birthday, but you will never remember why you missed it or the meeting you were in and what decision you made in the business side. So I love those examples. You're talking a lot about authenticity, and I want to like ask you a question. And vulnerability, like this is something, as you said, I also believe in. One of the pushbacks or one of the things people would be afraid of is being perceived as weak once you're in leadership positions, if you're sharing those vulnerable moments. So I'm intrigued throughout your career up to the now where you are, and being able to say vulnerably, like, I'm not feeling well, or all the discussions we're having on mental health. How do you think through this and making sure you're not weak when people actually need you to be strong, or being vulnerable when you feel is the right moment? Is there a moment in time where you feel like you can share, not share? I'm intrigued about how you think about this.
I think it took me time before really sharing that with authenticity, for two reasons. The first one is that I think I'm strong. People knowing me, most of the leaders I knew for years, they started to tell me, you are a man disguised in a woman. That's the worst things you can tell me, because I'm a woman. So, but perhaps my self-confidence and the way I say what I think with a lot of transparency. I'm very direct. So people see me as a strong person and as a man. So, it took me a time to share vulnerability, because it was difficult for me to see my own vulnerability. But with experience, because life is about experience, you learn step by step that it's more failures that make you learn than the success you had. So with that in mind, I started to share, and it's about one person. I remember one of my extraordinary PA, my personal assistant. One day she told me, you're sick, you're not in a good shape, but you are still there. What do you think about the example you give to the young people in your team? That means that even if you will die, you will come at work. Are you proud of yourself? That was a wake-up call for me. And from this day, I can remember this day. And I remember Nejima telling me that. And with that in mind, I totally changed my thinking about that. And I started to listening to myself first. And the starting point is to start with yourself before telling the other one about vulnerability. And right now it's easy for me to share that. But most often, especially young female, they told me it's easy for you to say you are vulnerable because people don't see you like that. But for me, because I'm young, I'm blonde hair, I seems to be weak by myself. If I share something personal, people will say, she has too much emotions, too many emotions. I say, no, you are who you are. But it's a key thing. It takes
for
time.
Sure. Yeah, and thanks for sharing this and saying it's just like, I don't know if it's absurd or not, but it's the reality, right? Like what you shared about you being a man disguised, right? Like we constantly hear this. It's I'm sure we as men hear it less. I heard though, like it's my woman side of things when I'm more into the humanistic part of leadership, which is mind blowing, right? Like it's just how we separate these. I'm in a constant fight also, even in retail stores, about why my daughters can get their NASA shirts or, you know, astronaut shirts. It's in the boys section. You know, it's just like, this is how we construct all those biases, unfortunately, socially. So thanks for doing what you're doing and pushing people and the society to be better.
Yeah, and my way to, I love your expression, to spread love. For me, my way to do that is to spread some of my tips, and I do that with all the women I mentor and with all the general manager, female general manager I met. I told them, if I support you, if I help you, if I am your mentor and you feel that it helps you, I just have one question and one request to yourself is, please do that to 2 other women after. Because if I support you, you need to do and to replicate the same at minimum to 2 other female. So that's the way to spread. So I check after if they do.
I want now to go into kind of a game where I will give you a word and I would love the first reaction that comes to your mind. So the first word is leadership.
Servant leader. 2 words.
Can you tell us a little bit more?
For me, it's really related to what I mentioned before. And it means for me a lot to be not only focused on people development, but to look how I can support the team, just to be sure I will listen to all the voices and be sure that the time I will dedicate it to them will be something really supporting individuals and the team in the same way. And it's for me, and especially after the COVID period, I spent a lot of time to think about the way we will lead our organization after the COVID. And for me, servant leadership is one of the most impactful way of leading an organization right now. And be sure that we can be part of a team, but be sure that everybody at of the organization has a word to say, has a voice that will be listened, and has opportunity to understand that they can make a difference and they are really important in the organization. It was part of my introduction yesterday during my sales meeting, that you are all an important piece of our own team, of our own puzzle. And every day, the impact or the difference you will make at the end, that will make a big difference for the patients. And that's for me the most important thing.
And this has always fascinated me, right? Like in healthcare, when comparing to healthcare provider, which is also an enormous noble purpose, right? And you help patients every day. But truly through leadership in our organizations, the impact that you can have, and each one's work is so important to change someone's life. So reminding our people constantly about the importance of our purpose and why they do what they do is so important. I'm going to go through a tangent and not another word, because I'm interested, since one of the big topics is hybrid work. You said you thought a lot about how to lead organizations after COVID. It's one of those big topics these days. How do you think of this you're leading a country, and actually sales is pretty virtual for usually. So I'm intrigued, how do you think about hybrid work or future work, whatever you want to call it?
For me, hybrid is still about relationship. I remember during the COVID, starting every morning with a coffee. So we had time virtually to take our coffee together, like before at the coffee machine, but be sure that we can start together. And for me, it was an opportunity to check that, the small signal, someone feeling alone, someone not doing well, and just be sure that this personal moment can make a difference. Right now, it's quite different because you have face-to-face meeting, you have virtual meeting, and you have this hybrid part where part of the team is in virtual, the other one are in the same meeting room. And for me, whatever the mode, if you have built before a strong relationship and you take care of each person in the meeting room, virtual or not, you can do the same. The difference is that you need to be more explicit, giving some rules. For example, be present. When you are in a face-to-face meeting, you can be present and you can have your computer just in front of you and looking at your emails coming and not being present to the meeting. So in virtual mode, you can't see that. So it's something you need to check more or to share some rules that are part of the way to live together and not being in a meeting. So it's about human relationship. And what is the most difficult things for me is COVID plus the new generation with remote time. What will be the key clue to motivate people? How can you make and design a team or make people feeling they are part of a team or a company if most of the time they are working from home? The question is not about working or not working. It's about feeling that you are part of the company. Because you are so far from your colleagues, you have not all these small moments that are more personal than professional. And that's the key question for me.
That's a really important one, belonging, right? Making sure that people feel they belong. And it's one of the most important parts of diversity, equity, inclusion, actually, if you feel this feeling of belonging and part of a bigger purpose. The second word is innovation.
Drugs.
You have to share a little bit more.
No, treatment for sure. Being part of a pharma company, innovation means new treatment. And for me, it's the hope we can cure most of the disease. Because most often I launched treatment that were for chronic disease where we were a treatment to make people having a better life with their disease. But the few opportunity I had in my career to cure a disease, it was only one time in hepatitis C. So to be honest, it's not enough. That's perhaps innovation. It's more about hope.
What about general management?
Diversity. It means for me that every day you can touch so many different topics a day. And because I'm so curious, you have opportunity to deal with many different topics in your company. But being curious, that means you have a lot of external interaction. So it's like, for sure, you lead your organization, you need to deliver your target, but you have opportunity to open a lot of new doors, giving opportunity to deal with new ideas and create something new ways of working, new ways of developing people. And it's exactly what I love. And it's not about the size of your company. It's about the way you look at your job.
And the last one is spread love in organizations.
Kindness. And the reason why I use this word is because I love the word love. But when I talk about love with people, they told me it's not for a company. It's for your personal life. And most often kindness, when you translate in French, it's very misunderstood. Because for me, taking care of people, it means that you will be supportive, but you will be demanding at the same time. So it's not something weak. It's something about looking at people with positive eyes, giving them a safety space when they can learn, they can grow, they can share their difficulties or theirs, and be able to be celebrated for success. But at the same time, when you are authentic, you are direct and positive, you can share with people constructive feedback, sometimes tough feedback, but you can help people to understand if they fit with their job, with their position. And it's not about themselves. They are not bad people or good people. It's about being sure that at this moment of your life, at this moment of the company, with this culture, you are fitting with this position, what is the core business you need to deal with, and be sure that you are happy with that. So it's not, you need to be courageous. So for me, kindness, love, most often people misunderstood what does that mean. And it's about challenge. It's about caring. It's a mix. Like in personal life. Huh?
Exactly. And I love how you framed it, because when you truly care, you're supportive and extremely demanding, actually,
Yeah.
because you believe in people capabilities and you want them to be at their best. Any final word of wisdom, Karine, for healthcare leaders around the world?
My final words will be perhaps the one I started with, saying that being authentic, be yourself, whatever happens. It's something that will drive you to your best. That's my personal conviction. And it's about alignment with yourself, your purpose, what you are dealing with every day. And I'm sure that the best way to be happy, to develop yourself and be able to support and develop others around you.
Well, thank you so much, Karine, for such a great discussion and for being with me today.
Thank you, Naji, for the opportunity. And it was great to have an opportunity to discuss leadership, because most often we talk about figures, and talking about leadership and people, it's really important for me. So thank you for this opportunity.
Oh, thank you for being here. And as you said several times, without leadership, you obviously cannot deliver exceptionally well. So it's interlinked. And thanks so much for all your vision about this. Thank you all for listening to Spread Love in Organizations podcast. Subscribe and connect with us on SpreadLoveIO.com or wherever you listen to podcasts. Most importantly, spread love in your organizations and spread the word around you to inspire others and amplify this movement our world so desperately needs.